Hi, my name is Parker Smith, and today I'm going to be presenting our poster over the rates of adolescent suicidal ideation in self-reported American Indian Alaska Native race, a cross-sectional analysis of the youth risk behavior surveillance system. Suicide is among the leading causes of death among children in the United States, ranking second among ages 10 to 14 and third among those 15 to 24. Non-Hispanic American Indian and Alaska Native individuals are disproportionately impacted by suicide, with a reported 28.1 out of 100,000 individuals dying from suicide. Previous research through the Minnesota Student Survey shows that individuals reported as American Indian Alaska Native demonstrated elevated rates of both suicidal ideation and suicide attempts compared to other ethnic groups. While current statistics indicate that the suicide rate is highest among non-Hispanic American Indian Alaska Natives, actual rates of suicide and suicidal ideation may vary due to the number of American Indian Alaska Native individuals who are classified as multiracial. So, our research question, we wanted to compare the rates of suicidal ideation among adolescents using the imputed race-eth variable in the Youth Risk Behavior Surveillance System, YRBIS, to compare to the self-reported ethno-racial identity. To do this, we conducted a cross-sectional analysis of the 2021 YRBIS survey to determine rates of both suicidal ideation and suicidal attempts between American Indian Alaska Native adolescents using the race-eth variable and self-reported ethno-racial categories that include American Indian Alaska Native alone and in combination with other races and ethnicities. We reported the sample rates and the population-weighted percentages using the sampling weights and survey design provided by YRBIS. So our results showed that just with the race-eth variable from YRBIS, individuals that were grouped as American Indian Alaska Native only showed a suicidal ideation rate of 27.3 and suicidal attempts rate of 21.85. Individuals who self-reported as American Indian Alaska Native alone with Hispanic Latino ethnicity showed similar rates of both suicidal ideation and suicide attempts, in comparison with the non-Hispanic Latino American Indian Alaska Native group, or the race-eth group. The main differences we saw were that suicidal ideation was most prevalent among individuals who self-reported as American Indian Alaska Native and white with Hispanic Latino ethnicity at 42.3%, individuals who reported as American Indian Alaska Native and Black or African American with non-Hispanic Latino ethnicity at 33.3%, and American Indian, Alaska Native, and Black African American and white with non-Hispanic Latino ethnicity at 41.05%. For suicide attempts, groups with the highest rates included self-reported American Indian, Alaska Native, and Black African American and white with non-Hispanic Latino ethnicity at 43.6%, and American Indian and Alaska Native and white with Hispanic Latino ethnicity at 32.43%. So while the race-eth variable within YRBIS is in line with other national estimates of suicidality among American Indian Alaska Natives, our study demonstrates that those estimates are likely missing key segments of the American Indian Alaska Native community. Rates of suicidal ideation and attempts were much higher among adolescents reporting as American Indian Alaska Native in combination with white with Hispanic Latino ethnicity, as well as non-Hispanic Latino ethnicity in combination with Black or African American and white. Both of these groups had 12 to 21% higher than the American Indian Alaska Native alone from the race-eth variable. Our study highlights the need for healthcare workers focused in pediatrics, family medicine, and psychiatry to be aware of these disparities, as well as the need for more public health research with an expanded view of Indigenous identity. The use of multiracial categories for analysis has the potential to seriously underestimate psychosocial concerns for American Indian and Alaska Native adolescents belonging to more than one race or ethnicity. Healthcare providers should be mindful of the complexities related to identity and how specific research methodologies may result in underreporting of psychosocial concerns. While the YRBIS provides self-report data related to ethnicity, many other large datasets do not. It is imperative that other datasets allow researchers the ability to disaggregate data to further explore how the use of multiracial categories impacts population health findings. Thank you all.